All right, so today we're going deep into depressive disorders.
Oh, yeah.
And we've got a fantastic guide, the Handbook of Clinical Psychopharmacology for Therapists.
Nice.
9th edition. So we're talking serious business here.
Absolutely. And you know what's so cool about this chapter is that it goes beyond just like listing symptoms.
Oh, yeah.
We're going to really explore the different types of depression and how to like distinguish them.
Right.
And even touch on the biological processes, you know, the stuff that's happening in the brain.
Yeah, so we're going to come away from this with like a much more nuanced understanding of what depression actually is.
Exactly.
So where do we even begin?
Well, the handbook starts by making a super important distinction.
Okay.
Not all sadness is depression.
Okay.
It's more like a spectrum.
Okay, spectrum. I like that. Tell me more.
Okay, picture a staircase, all right?
Mm-hmm.
First step, that's what we call reactive dysphoria.
Reactive dysphoria.
It's basically that feeling you get when life throws you a curveball, you know?
Yeah.
Like your coffee shop is out of oat milk.
Right.
Or your train's delayed, just everyday annoyances.
Yeah, those little things that just kind of bring you down.
Exactly.
And it's temporary, you bounce back.
Totally. You're still able to function.
Yeah, go to work, see your friends.
Exactly. It's a totally normal, healthy reaction to life's little letdowns.
Okay, makes sense. So what's the next step up on this staircase?
So next step up, that would be grief.
Grief.
Yeah, and this is obviously a much deeper, more intense sadness.
Of course.
Usually triggered by a significant loss, like the death of a loved one, or a job loss, or even the end of a relationship.
Yeah, this is like way more serious than just having a bad day.
Oh, absolutely. Grief can significantly impact your work, your social life, you know, really every aspect of your life.
Right.
But this is really crucial grief. While it's incredibly painful,
Yeah,
it's a healthy and necessary process.
it is.
It's how we process loss and eventually heal.
So how do we know when grief crosses the line into clinical depression?
That is the million-dollar question.
Right, because that can get kind of murky.
Absolutely. And that's where these two key distinctions come in.
Okay, 2 key distinctions. Lay it on me.
Okay, so first with grief, your self-esteem generally remains intact.
Okay,
You might feel lost, sad, even angry,
right.
but you don't question your worth as a person.
Okay.
With clinical depression, that self-esteem takes a real hit.
So like the foundation starts to crumble a little bit.
Yeah, exactly.
Okay.
And the second key difference is that grief, even when it feels overwhelming, it's ultimately adaptive.
Okay.
It's a process that leads to healing and moving forward.
Yeah.
Clinical depression, on the other hand, it keeps you stuck. It's like a broken record of negative thoughts and feelings.
Okay, so it's about self-worth and the ability to heal.
Yeah,
But I imagine there are times when grief can become more complicated.
definitely.
Like it might morph into something more serious.
Yeah.
So what are some of the red flags to watch out for?
So the handbook outlines several red flags.
Yeah.
Things like a significant drop in self-esteem.
Okay.
Extreme education difficulty, sleeping, especially waking up super early in the morning,
Mm-hmm.
sudden weight loss, and then even more serious symptoms like psychosis
Wow.
or suicidal thoughts.
Okay, so this is beyond just the normal ups and downs of grieving.
Absolutely.
This suggests something deeper might be going on.
Right. And that's when professional help is absolutely crucial.
Right.
It could be that grief has transitioned into clinical depression.
Okay.
And speaking of clinical depression,
Yes, let's go there.
let's dive into the different types.
Yeah, this is the real deal territory.
This is it.
Okay.
So the handbook focuses on major unipolar depressions,
Mhm.
which can be further categorized into 4 main types.
Okay.
We've got reactive biological,
Oh.
and atypical depression, which is kind of a tricky one.
Okay, we'll unpack those.
Let's do it.
So reactive depression, what does that look like?
So reactive depression is essentially triggered by a stressful life event,
Okay.
or sometimes a series of stressful events.
Right.
So it's like a reaction to something happening in the person's life.
So the root cause there is psychological.
Primarily, yes.
Okay.
It could be a sudden event, like losing a job or a relationship breakdown, or even just a gradual buildup of stress, like a toxic work environment or a chronic illness.
Right.
And what distinguishes reactive depression is that those physical symptoms that we'll talk about later,
Right.
they're less prominent.
So somebody might feel intensely sad, hopeless,
Right.
but their sleep, their appetite, their energy levels aren't as drastically affected.
Exactly.
Okay.
Now, on the opposite end of the spectrum, we have biological depression.
Okay, biological depression.
And this is where the brain chemistry comes into play.
This is where it gets really
This
interesting.
is the nitty-gritty.
Yeah, tell me more.
So with biological depression, the root cause isn't necessarily a stressful life event.
Okay.
It can emerge seemingly out of the blue,
Wow.
even when life is going relatively well.
Okay.
The trigger is an imbalance in the brain's neurochemicals.
So it's like a glitch in the system.
A good way to put it, and there are many contributing factors. It could be medical conditions that affect brain function, like thyroid disorders,
Mm-hmm.
hormonal fluctuations, especially during menopause or postpartum,
Oh, wow.
and even prolonged substance abuse.
So it really is like mind and body are completely connected.
Absolutely.
Yeah.
And now with biological depression, we often see a distinct set of physical symptoms.
Okay, let's talk about that.
Yeah.
Because I think this is where a lot of people get confused.
Absolutely.
Like, what are those physical symptoms?
So these are often called vegetative symptoms.
Vegetative symptoms.
Yeah, and they include things like appetite changes,
Okay.
significant weight loss, or gain persistent fatigue,
Mm.
sleep disturbances, particularly early morning awakening,
Yeah.
decreased libido, and even restlessness or agitation.
So it's not just feelings, it's actually showing up in the body.
Right, and these symptoms are really crucial because they often signal that there's an underlying biological component to the depression.
So that's a key indicator that medication might be needed.
Exactly. If the root is biological, then addressing those biological factors is essential.
Makes total sense.
And that brings us to a third type, reactive biological depression.
Okay, so this is kind of a hybrid?
Yes, it's a hybrid.
Okay.
It starts with a stressful life event like reactive depression.
Mm-hmm.
But over time, those physical symptoms we just discussed begin to emerge.
So it's almost like the psychological stress triggers those changes in the brain chemistry.
That's a great way to visualize it, and this is actually the most common type of depression we see in clinical settings.
Wow.
It's this intricate dance between psychological and biological factors.
Really highlights how nuanced and individualized this can be.
It really does, and before we move on to that last type, atypical depression,
Okay.
there's an important point we need to address: screening for bipolar disorder.
Okay, this sounds important.
It is super important. Misdiagnosing bipolar depression as unipolar depression can have serious consequences.
Because the treatment approaches are so different.
Exactly. Antidepressants, which are often the first line of treatment for unipolar depression,
Right.
they can actually be risky for someone with bipolar disorder.
Oh, wow.
They can trigger manic episodes
Okay.
or even worsen the course of the illness over time.
That's a critical point. So how do we differentiate?
So the handbook points to a few key indicators.
Okay.
Depressive episodes that involve excessive sleep, so hypersomnia,
Okay.
extreme fatigue, increased appetite, especially cravings for carbohydrates,
Mm-hmm.
weight gain, and particularly the presence of psychotic symptoms,
Wow.
like delusions or hallucinations.
Okay, so those are definitely not your typical unipolar depression symptoms.
Right, and a family history of bipolar disorder is a major red flag.
Okay.
So the takeaway here is that thorough screening is paramount.
Absolutely.
It's not just about identifying depression, it's about getting the diagnosis right to ensure safe and effective treatment.
Right, so we've covered reactive biological and reactive biological depression.
Yes.
What about that last one you mentioned?
Atypical.
Atypical depression, what makes it so tricky?
Atypical depression, it's kind of like the rebel of the depression family.
Okay.
It doesn't always follow the classic script,
Mm-hmm.
which can make it tricky to diagnose.
So it's atypical in terms of how it presents?
Exactly.
Okay.
One of the hallmarks is its mood reactivity.
Okay.
So instead of a constant low mood, people with atypical depression experience shifts in their mood,
Okay.
depending on what's going on around them.
So it's more reactive like the name suggests.
Right on. But here's where things get interesting. Atypical depression also often comes with symptoms that we don't typically associate with depression.
Like what?
Things like increased appetite, weight gain, sleeping more than usual, and a heavy leaden fatigue.
Wait a minute, overeating and sleeping too much can be signs of depression?
It can be pretty confusing.
That's not what most people picture.
Right, and even lead to misdiagnosis.
Wow.
And to add another layer of complexity, people with atypical depression tend to be highly sensitive to rejection or criticism.
Okay.
Even minor negative feedback can feel devastating.
Wow, that sounds incredibly challenging to navigate.
It can be, and because these symptoms don't fit the classic depression mold,
Right.
atypical depression is sometimes misdiagnosed as an anxiety disorder or even a personality disorder.
So it really underscores the importance of careful, thorough diagnosis.
Couldn't agree more. And the handbook emphasizes something we touched on earlier,
Mm-hmm.
the need to rule out bipolar disorder, especially when we see these atypical features.
Right, because treating atypical depression as unipolar depression when it's actually bipolar could have some really unintended consequences.
Exactly. Remember those antidepressants we were talking about?
Yeah,
They can trigger manic episodes in people with bipolar disorder.
right?
So a detailed assessment, including family history and a close look at the symptoms, is absolutely essential.
Okay, so we've explored those four main types of clinical depression: reactive biological, and the trickster atypical depression.
Yeah?
Now let's shift gears a bit and delve into what's happening in the brain.
Okay.
What are the underlying causes?
That's the big question.
Right.
And research is ongoing, but the handbook dives into some fascinating theories,
Okay.
particularly the biogenic amine
Yeah,
hypothesis.
that's
It's been a dominant theory in the field for decades.
So break that down for me. What is the biogenic amine hypothesis all about?
In essence, this theory proposes that depression stems from a dysfunction of key neurotransmitters in the brain,
Mm-hmm.
specifically serotonin, norepinephrine, and dopamine.
Oh, yeah, those are the brain's chemical messengers, right?
Exactly.
Responsible for mood and all that good stuff.
Exactly. They regulate mood, motivation, sleep, appetite, and a whole bunch of other functions.
Okay.
So the biogenic amine hypothesis suggests that in people with depression, these neurotransmitters are either not being produced in sufficient quantities,
Mm-hmm.
or they're not being used efficiently.
So it's like the brain's internal communication system is breaking down.
That's a fantastic analogy.
Right.
How this dysfunction happens is still being researched.
Right.
But there are several possible mechanisms. One is reuptake,
Reuptake.
where neurotransmitters are quickly reabsorbed back into the nerve cells after being released.
So they're not hanging around long enough to do their job.
Exactly. Another possibility is that there simply isn't enough of these neurotransmitters being produced in the first place.
Okay.
And then there are enzymes like monoamine oxidase, which can break down these neurotransmitters too quickly.
So it's a multifaceted issue.
It is, and it's important to note that the biogenic amine hypothesis isn't the whole story.
Right.
There's increasing evidence that other factors play a role,
Like what?
such as inflammation, hormonal imbalances, and even genetics.
So it's a real puzzle with lots of pieces.
You got it. And speaking of puzzle pieces, researchers have been able to identify some biological markers for depression.
Oh, okay. What have they found?
Well, one is reduced metabolic activity in the frontal lobes of the brain.
Okay.
That's the area responsible for planning, decision-making, and emotional regulation.
So it's like the brain's control center is not functioning at full capacity.
That's a good way to think about it.
Right.
Other markers include abnormalities in sleep EEG patterns
Okay.
and genetic markers that suggest a hereditary component to some forms of depression.
So we're slowly piecing together this complex biological puzzle.
We are.
But how does all of this translate into treatment?
That's the key question.
Right. What are the practical applications of all of this knowledge?
Well, understanding these biological underpinnings has led to a range of treatment options.
Okay.
Antidepressant medications, for example, work by targeting those neurotransmitters we were just talking about.
Right.
They essentially help boost levels of serotonin, norepinephrine, or dopamine in the brain.
So they're trying to restore that balance in the communication system.
Exactly, but it's not a one-size-fits-all approach.
Right.
There are many different types of antidepressants, each with its own mechanism of action and potential side effects.
Mm-hmm.
So finding the right medication for an individual often involves some trial and error.
And it's important to remember that medication is just one piece of the puzzle, right?
Absolutely. The handbook emphasizes a holistic approach to treatment,
Okay.
combining medication with psychotherapy to address both the biological and emotional aspects of depression.
It's about treating the whole person, not just the symptoms.
That's the key. Psychotherapy can equip people with coping skills, help them challenge negative thought patterns,
Right.
and address any underlying psychological issues that might be contributing to their depression.
So it's about empowering people to manage their condition and build resilience.
Precisely. And in addition to medication and therapy, there are other emerging treatment options that the handbook touches on.
Well, I'm all ear. Tell me about some of these newer approaches.
Well, one is electroconvulsive therapy, or ECT.
ECT.
It might sound intimidating,
Yeah.
but it's actually very effective for severe depression, particularly when other treatments haven't worked.
Okay.
It involves inducing a brief seizure under anesthesia.
Wow.
The exact mechanism isn't fully understood,
Okay.
but it seems to reset brain activity in a way that alleviates depressive symptoms.
It's amazing how much we're still learning about the brain and its incredible ability to heal.
It really is. There's also transcranial magnetic stimulation, or TMS.
TMS?
It's a non-invasive technique
Okay.
that uses magnetic pulses to stimulate specific areas of the brain.
Interesting.
It's showing a lot of promise as a treatment for depression, especially for those who haven't responded to medication.
So it's a more targeted approach to brain stimulation?
Yes, exactly. And there are even more experimental approaches being researched, like vagus nerve stimulation and deep brain stimulation. regulation,
Wow.
which involved implanting devices that deliver electrical impulses to specific parts of the brain.
That's incredible.
These are still in the early stages of research, but hold potential for treating cases of depression that are resistant to other treatments.
It's incredible how technology is being harnessed to address mental health conditions.
It truly is, and what's exciting is that we're seeing a convergence of different fields.
Yeah.
Neuroscientists, psychologists, and engineers are all collaborating to develop new and more effective treatments for depression.
So it's a truly collaborative effort to tackle this complex challenge.
It is, and while we've been focusing on these high-tech treatments, the handbook also highlights the importance of lifestyle factors in managing depression.
Oh, that's a great point. What kind of lifestyle changes can make a difference?
Well, exercise, for one, has been shown to have antidepressant effects, particularly aerobic exercise.
Okay.
It seems to boost those same neurotransmitters that are depleted in depression.
So hitting the gym or going for a run can be a form of self-care.
Exactly. And then there's sleep. Getting enough sleep and keeping a regular sleep schedule are crucial for mood regulation.
So it's all about those healthy habits.
Right. And nutrition plays a role too. A balanced diet full of essential nutrients can really support overall brain health.
It's a reminder that taking care of our physical health is essential for our mental well-being.
They're so interconnected.
Yeah, they absolutely are.
Now, there's another important concept. The handbook discusses treatment-resistant depression.
Okay, this sounds concerning. What does that mean exactly?
Essentially, it's when someone doesn't respond to 2 or more antidepressant medications from different classes.
Wow.
It's estimated that about a third of people with depression fall into this category.
That's a significant number of people. So what happens then? What are the options?
Well, it certainly doesn't mean there's no hope. It just means a more individualized approach is needed.
Okay.
Sometimes it involves trying a combination of different antidepressants or adding other types of medications like mood stabilizers or atypical antipsychotics.
So it's about finding the right cocktail of treatments that works for that specific person.
Exactly. And for some, those newer treatments we talked about, ECT or TMS, might be more effective options.
So there's always hope, and there are always options to explore, even when the initial treatments don't seem to be working.
That's the key message, and I think this leads us to a really important question that the handbook raises.
Okay.
Why are rates of depression so high? And what role might our modern lifestyles be playing in this? Yeah, it's a fascinating question, you know?
Yeah, it seems like we have more access to treatment and support than ever before,
Right.
but yet depression rates just keep climbing,
They do.
especially among younger generations.
Yeah, it's a bit of a paradox.
Yeah.
You know, the handbook doesn't dive too deeply into this,
Right.
but it's definitely food for thought.
Yeah.
You know, researchers are exploring a number of potential contributing factors.
Like what?
Well, one of the big ones is the pervasive influence of social media.
Social media, I can definitely see how that could play a role.
Yeah.
There's so much pressure to present this like perfect image online,
Right.
and it's so easy to get caught up in comparing yourself to others.
Absolutely. And then there's the constant barrage of information
Oh, yeah.
that we're exposed to online.
Right.
It can be so overwhelming
Yeah.
and create this sense of anxiety and unease.
Like we're hyper-connected digitally,
Yeah.
but increasingly isolated in the real world.
That's a great way to put it. And then we can't overlook the impact of chronic stress.
Right.
Our always-on, fast-paced culture.
Yeah.
You know, it can create this constant state of low-grade stress,
Mhm.
which over time can really take a toll on our mental and physical well-being.
It's like our brains are constantly in overdrive
Yeah,
with no time to like rest and recharge.
exactly.
Well, I wonder if we're feeling burned out.
And then there's the sleep deprivation piece.
Right.
You know, as a society, we often sacrifice sleep for work entertainment or even just scrolling through our phones late at night.
Or the things.
And we know that chronic sleep deprivation can disrupt those delicate neurotransmitter balances we talked about earlier, further contributing to mood dysregulation.
So it's this vicious cycle: lack of sleep, increased stress, more time spent online.
Exactly.
Yeah.
So while the handbook doesn't provide all the answers, it
Yeah.
does give us a framework for understanding the biological underpinnings of depression,
Right.
which can help us make sense of these broader societal trends and their potential impact on our mental health.
It's a reminder that depression is complex.
It is.
It's this interplay of biological, psychological, and social factors.
Precisely. And that understanding can guide us towards more effective prevention and treatment strategies.
Right.
It's not just about addressing the symptoms. It's about creating a culture that prioritizes mental well-being
Yeah.
and supports individuals in leading healthier, more balanced lives.
Well, I have to say, I feel like we've really unpacked a lot today.
We have.
We've explored the different types of depression,
Mm.
the potential causes, the variety of treatment approaches,
Yeah.
and even touched on those broader societal influences that might be contributing to the rising rates.
We've covered a lot of ground.
We have.
And most importantly, I hope listeners now have a deeper appreciation for the complexity of depression,
Right.
the absolute necessity of accurate diagnosis,
Yes.
and the importance of personalized treatment plans.
It's not one size fits all.
Not at all.
And there's no magic bullet.
Nope.
But there's always hope.
Absolutely.
And there are effective treatments available.
There are.
And remember, if you or someone you know is struggling, reaching out for help is a sign of strength, not weakness.
That's right. And as we continue to unlock the mysteries of the brain,
Yeah?
we can expect even more innovative and personalized treatments to emerge in the coming year.
This has been an incredibly insightful deep dive. Thanks for guiding us through this complex topic.
It's been my pleasure. And to our listeners,
Yes.
we hope this knowledge empowers you to better understand depression
Mm-hmm.
and advocate for yourself or others who might be struggling.
Yes.
Remember, you're not alone.
That is a fascinating question. It really is. And, it seems like we have more access to treatment and support than ever before,
Right.
and yet those rates just keep climbing,
Yeah.
especially among younger generations. So it really is, it's kind of a paradox,
It is a paradox. And, the handbook doesn't dig deep into this, but
right?
it's definitely something to think about.
Yeah.
Researchers are exploring a lot of different potential contributing factors.
Like, what are they looking at?
Well, a big one is social media, the influence of social media.
Social media, yeah. I can see how that could play a role.
Yeah.
There's so much pressure to present this perfect image online.
Right.
And then, you just get so caught up in comparing yourself to other people.
Absolutely. And then there's just this constant barrage of information
Oh, yeah.
that we're exposed to online.
It could be so overwhelming.
It can be totally overwhelming, and it can create this sense of anxiety and unease.
Yeah, like we're hyper-connected digitally,
Right.
but increasingly isolated from each other.
That's a great way to put it. And, we can't forget about the impact of chronic stress.
Of course.
Our culture's always, it's so fast-paced.
Yeah,
It creates this constant state of low-grade stress, and that takes a toll
it does.
over time on our mental and physical well-being.
It really does. It's like our brains are in overdrive all the time.
Yeah.
With no time to rest and recharge.
Exactly.
So no wonder we're feeling burned out.
No wonder. And then you add the sleep deprivation piece on top of that.
Oh, yeah.
As a society, we sacrifice sleep, we stay up late, we're working, we're on our phones,
Right, sure.
we're entertained, and we know that chronic sleep deprivation disrupts those neurotransmitters
Right.
we were talking about earlier, which just contributes to mood dysregulation.
Yeah, so it's like this vicious cycle.
It is a vicious cycle.
Lack of sleep, increased stress, more time spent online.
Exactly. So, the handbook doesn't give us all the answers,
Right.
but it does give us a framework for understanding those biological underpinnings of depression.
Right?
And that can help us make sense of, these broader societal trends
Right.
and how they're impacting our mental health.
Yeah, it's a reminder that depression is this complex thing.
It's so complex.
It's biological, it's psychological, it's social, all these factors.
Exactly. And, understanding that can help us
Yeah,
guide us toward more effective prevention and treatment strategies.
absolutely.
It's not just about addressing the symptoms.
Right.
It's about creating a culture that prioritizes mental well-being
That's so important.
and that supports people in leading healthier, more balanced lives.
Yeah, well, I have to say, this has been an incredibly insightful deep dive.
It has.
We explored the different types of depression, the causes,
Yeah.
the different treatment approaches,
Mm-hmm.
and even, touched on those broader societal influences that could be contributing to the rise.
We covered a lot of ground.
We did. And most importantly, I hope, our listeners now have a deeper appreciation for just how complex depression is.
Yes.
And how important it is to have an accurate diagnosis
Absolutely.
and really create that personalized treatment plan.
It's so important.
Yeah, it's not a one-size-fits-all. There's no magic bullet.
Not at all.
But there's always hope.
Always.
And there are those effective treatments available.
Yes. And
And it's so important to remember,
yes.
if you are struggling or, someone who's struggling,
Yeah.
that reaching out for help is a sign of strength, not weakness.
Absolutely, it's a sign of strength. And, as we continue to kind of peel back the layers of the brain, we can expect even more innovative and personalized treatments in the years to come.
I can't wait. This has been a really insightful deep dive. Thanks for guiding us through this complex topic.
It's been my pleasure. And to our listeners,
Yes.
we hope this knowledge empowers you to better understand depression and to advocate for yourself or others who might be struggling.
Yeah.
Remember, you're not alone.